of general notes. Sometimes experiments are called trials. And for those of you who are based in hospitals and you do experimental studies, your trials are usually called clinical trials. So a clinical trial is one type of an experiment. But not every experiment is done in a clinical situation. And we'll see an example in a few minutes of a study that was not done in a clinical hospital situation. Is that experiments are types of cohort studies, but they're special types of cohort studies. What differentiates an experiment from a non-experimental cohort study, usually we'll refer to those as observational cohort studies, is that the experiment has a certain feature that defines it to be an experiment. And the feature is that the exposure status is assigned to people. It's not something they choose themselves. It's not that they choose to eat Spam. It's not that they choose to take an aspirin every morning to maybe prevent a heart attack from occurring. But someone decided that they would eat this Spam diet, or someone decided they'd take an aspirin rather than another pill every day. So the exposure status in an experimental study is determined by the investigator of the study. You assign treatment status to individuals. And usually, you're giving a treatment to one group of people, and you're comparing them to a standard of care. That's usually done in a clinical study. You're comparing a brand new treatment for, say, cancer patients. You're comparing the new treatment to the existing best treatment, which we call the standard of care. Or you might be doing a non-clinical prevention study. You'll be giving people a particular diet to see if it prevents them from developing a disease, or giving them recommendations for a certain lifestyle to see if it prevents them from, say, developing diabetes or developing obesity. And typically there, what you're doing is comparing a new preventive agent to often what is known as a placebo. And I'll talk about placebos in a few minutes. But the point is that in experimental studies, people are assigned one type of treatment versus another, or one type of preventive agent versus another, not because their doctor thinks this treatment is best for them, or their public health professional thinks that this preventive agent is better than another, but the investigators assigning people to one treatment arm versus another, or to one agent versus another, because they want to determine which of these two treatments is better, or they want to determine which of these two preventive agents is better. So for scientific purposes, you are assigned to one treatment arm versus another. And therefore, this is different from all the studies we talked about before. All the studies we talked about before, the people themselves decided what diet they were going to choose, or the people themselves decided where they were going to live. Now the investigator is determining which diet they receive, or the investigator determines which treatment they receive. That opens up a brand new set of questions, a brand new set of ethical questions that we're going to have to talk about. So that's the main difference between an experimental study and a cohort study, the treatment assignment, the exposure assignment. So let me give you a couple of examples. And the one I'm going to start with is one that one of you guys suggested a couple of weeks ago when I asked you to think about how you would design a study to see if a diet that was rich in Spam had some impact on your health. And this was one of the studies that was proposed, and we mentioned it in the very first lecture. Remember what it was is one of you suggested going to the medical school, John A. Burns School of Medicine, enrolling first and second year medical students into the study, enrolling 100 such students, and then randomizing, we'll talk about randomization in a minute, them into two different arms, two different treatments, or two different exposure status. The Spam arm would be one given to students, and they would receive it breakfast and lunch every day in their cafeteria. That would be based on using Spam recipes. So this is the diet that's heavy in Spam. The control arm would be given to 50 of the other students. They would receive, again, breakfast and lunch from the cafeteria, but they would not receive a diet that's rich in Spam. They would receive a Spam-free diet. And both groups would receive their food from the same facility. Both groups would be asked to come back 6 months later, 12 months later, 18 months later, have some examination performed on them, see if they've gained weight, see if they've decided if they have any biomarkers that might suggest they're at higher risk of developing diabetes, ask them about their physical activity. So that was a study that one of you suggested to do. And this would be an experimental study because you, the investigator, decide whether a student's in the spam arm part of the study or the control arm. 100 students themselves don't decide. A coin flip decides. You, as the investigator, flips a coin. The coin comes up heads. That student is assigned to the spam arm. If the coin came up tails, that student's assigned to the control arm. So that's where you, the investigator, decides how a person's going to be treated. Well, back when I gave you that second homework assignment and described this to you, I asked you to think about some questions. And just think, let's do a little mental, free associating here. I'll give you my opinions on these questions, but hopefully this is something you've thought about. First of all, what are the advantages or disadvantages of enrolling medical students? Well, are medical students typical students? I mean, are they typically representing people who are 19, 20 years old? That's how old most of the medical students are. If you went on the streets of Honolulu and randomly selected people walking by, you would not be selecting medical students unless you were standing in front of the John Burns School of Medicine. You'd be selecting a different population. So your medical students were not selected because they were probably typical of that age group living in that location. I guess the reason this particular participant, the person among you who suggested this study, is you might think that medical students are more likely to say, yes, I'll agree to be in this study. I'll agree to let a coin determine what I'm going to be eating for breakfast and lunch for the next weeks or months. And maybe because they're interested in health and interested in trying to promote health in populations, they'd be more willing to be experimental subjects in this study. So one reason for selecting medical students is that they might be willing to say, yes, I'll be part of this study. Another reason I think maybe you selected medical students is because they might be more willing to stay in the study once the study begins. Because remember, what you're going to ask these people to do is every day eat what the experimenter, the investigator decided you will eat. The coin came up heads, you're going to be eating spam a lot of the time. Well, maybe you don't like spam, and it's going to be a bit of a challenge for you to eat this diet. Medical students, because they're part of the health professional field, might be willing to do this. If they were assigned by a flip of a coin that showed a tail to be in a diet that was not heavy in spam, you're asking them to give up eating spam during the part of the study. So that's another reason to try to improve compliance, because I mentioned compliance is an important feature of any experimental study. If people don't take the treatment you're assigning them to take, then it's going to be very difficult to see if that treatment has any advantage over the comparison group in terms of the outcomes you're measuring. So compliance is a very important feature. Someone else just mentioned another reason is convenience sample. Yes, I could see if you need to enroll 100 people, maybe the quickest way you can get your hands on 100 young people is to hit your medical school up. So that's a third reason. But I would really like this idea of enrolling people who are more likely to say yes, and more importantly, more likely to comply with what the study is going to ask them to do. Ask them to stick with a certain diet and come back 6 months, 12 months, 18 months, and be prodded, probably having blood taken, probably having urine being taken. Maybe other people might not be so willing to do this. So that's one reason. Those are the reasons I like enrolling these students. What are the advantages of disadvantage of random assignment? An alternative would be to say, okay, the students themselves can decide which diet they want to take for the next weeks and months. The problem with that is if these medical students are people who like spam, and you give them the choice of which of these two diets they're going to be using for the next weeks and months, the spam users are probably going to choose the spam diet, and the non-spam users are probably going to choose a non-spam diet. And what's going to happen if 90% of your people are spam users among your incoming class in this medical school? You're going to end up with a study with 90 people in the spam arm and only 10 people in the non-spam arm. Randomization, though, when you flip a coin, has roughly a 50% chance of getting a head and a 50% chance of getting a tail. It's going to be exactly that if it's a fair coin. So if you have 100 students and you flip coins, I would roughly expect 50 of them to be put into the spam group, 50 of them in the non-spam group. And statistically, That's a much better design to have. 50 people in one group and 50 people